Gum disease arises from our body's response to bacteria living along the line where our gums meet our teeth. This picture shows the gum line in a healthy mouth. This is a mouth anyone could be proud of. Most of us start this way, but for many it soon goes wrong, as you will see.
If few bacteria collect, the response is small and most people will not have a problem. Some people react more than others, so masses of bacteria in one person may cause little gum disease, whilst the most sensitive will develop the problem even with small amounts. Sometimes very aggressive bacteria may be present and rapidly cause problems around a few teeth. Part of my assessment is to decide what the main causes are for a particular person and advise them.
Gum disease takes time to develop, and the worst occur after months or even years, slowly and almost imperceptibly taking over, reaching the point where false teeth may be the only option. It's probably something friends don't like to tell, although they may be unwittingly aware of it for some time as they notice bouts of bad breath. The sufferer generally doesn't feel pain or notice bleeding of gums, particularly if they are smokers. Poor brushing usually contributes, allowing bacteria to grow, spreading along the gum line. After a few days our cells detect their presence and swelling begins. It doesn't take long before the gums swell to 2 or 3 millimeters and become soft enough that bleeding starts when brushing. Whatever you do, don't stop brushing, instead be even more thorough. The whole of your gum line may swell to a depth of 2 millimeters. If it were possible to remove the swollen parts and lay them out flat on a surface, they would spread to the size of the diameter of a golf ball. This size sore can occur in teenagers and may persist and worsen over the next 20 or 30 years. Not only will this cause tooth loss, but also put an enormous strain on the immune system and other systems, so it's not surprising when we find links to heart attacks, blood clots, diabetes, and preterm births. As the disease progresses, the swelling causes the fibres holding the gum to the tooth to break down, so that deeper pockets appear around the teeth. Then bone is taken away from around the teeth until they begin to move with finger pressure, eventually loosening, often needing to be taken out, and false teeth required.
If you have gum disease, you're not alone, because 90% of adults suffer from it. I estimate 40% of people have the equivalent of golf ball diameter sores, 20% have tennis ball diameter size, and 10% have about the same as the end of a can of baked beans, about 7 centimeters across. Most of this is either untreated or not adequately treated, leaving people more vulnerable to effects elsewhere in their bodies. In another film I will talk about new ways to stop the disease when brushing doesn't seem to be controlling it. People often comment about how unfair it is that they have problems, even though they are so careful. For the present, we are unable to influence genetic makeup, but have made remarkable strides in controlling bacteria.